Hello, everybody. My name is Dave Crawford. I'm Director of Training Development for CASAC Training. If we have not met yet, today's training will be on counseling skills. I do have a short video, kind of just give you a quick overview, and then we'll discuss some of the kind of key points in it.
Hey guys, welcome to this Mometrics video of the basic skills of a counselor. Research is continually proving that positive outcomes are less predicated on a certain type of therapy as they are on the counselor's ability to be enthusiastic, confident, and present a belief in the patient's ability to change. We can't change people. However, we can be helpful in encouraging our clients to move towards change. It would appear that clients are more likely to achieve their goals when there is a healthy and trusting relationship that exists between the client and their therapist. So naturally, the way in which the counselor engages the client can be a very effective tool in the helping relationship. Today, we'll talk about the 9 most basic counseling skills. Number 1, listening. Think about the people who you feel most heard and understood by. Generally, the reason we feel as though they're listening has a lot to do with their body language or posture towards us. In counseling, this is called attending. Attending just means to position yourself to the patient in a way that lets the patient know you're aware of them, that you have their full undivided attention, and that you care about what they have to say and in general who they are as a person. There are some important things to be aware of to make sure that you are attending. Make eye contact. Remove anything from the room that may distract you from focusing on your patient. Nod your head at appropriate times to confirm that you're hearing what they're saying or that you identify with what they're saying. Try not to move around a ton. Though you may not mean to, moving around can suggest that you're antsy and ready for them to stop talking. You never want them to feel like you don't want them to be there or that you have better things to do. Make encouraging verbalizations. Try even to mirror their posture and language. This can make your client feel more comfortable and free. Lean forward. This shows your client that you are engaged. There are many other aspects of body language that may depend on that specific patient. Researchers suggest that 80% of communication actually takes place non-verbally. So attending is an important way that you communicate to your patient that you care about them. But just like with anything, we can go through the motions, do all the right things, but our minds and our hearts can be far off. We need to be sure that we're retaining and understanding the verbal and nonverbal information conveyed by that patient. This is called observing or actually listening. Content and process are 2 main sources of information to draw from to make sure that we are understanding what our patient is communicating. Content refers to what is actually being said. Be careful to listen to not only what a person says, but also the words, expressions, and patterns the person is using, which can give you deeper insight. It may also be important to recognize what is not being said. Counselors should also develop an ability to remember what was said and to clarify with the patient what was said. Process refers to all nonverbal communication, including how the content is being presented. You don't just want to be conscious about your nonverbal communication, but an important part of listening is being aware of the patient's as well. This can be reoccurring themes, body language, interactions, etc. Skill number 2, empathy. Empathy does not mean that you have to identify with the patient or share similar experiences. You may not actually know how they feel, but it's important to develop the ability to discern another's experience and then communicate that perception back to the individual to clarify what they have said. The main skills involved in communicating empathy are nonverbal and verbal attending, paraphrasing what the patient has communicated, reflecting on how the patient feels, and also on implied messages. Now, we already talked about attending, but just to review, this involves our conduct, which communicates to the patient that we are paying full attention to what they are saying in a caring and helpful way. Paraphrasing. You want to focus on keywords and main ideas that the client has communicated and communicate them back to your patient in a rephrased, shortened form. This not only communicates to your client that you heard what they're saying, but also that you're trying to really understand them more deeply. Here are 4 tools to help you paraphrase. Listen and recall everything that the client expressed to make sure that you recalled everything and did not miss any significant details. Identify the content aspect of the information that the client has shared by deciding what event, situation, idea, or person the client is talking about. Remember, content refers to what is actually being said through words, expressions, and patterns, and oftentimes even through what they omit. Rephrase the entirety of what they've communicated, yet as briefly as possible. Use the key words and main ideas that the patient has used to repeat back to them in a fresh way. Perception check. This allows for the client to confirm or deny the precision of your paraphrase. You never want to put words into their mouth, so a helpful way to make a perception check is to do it in the form of a question. For example, it sounds like blank, or let me see if I understand this. Reflecting on the patient's feelings. You want to go back over what the client has communicated directly through words as well as through nonverbal behaviors in a respectful, open-ended approach. You also want to make a fair deduction about what your client may be feeling emotionally. It is imperative for you, the counselor, to choose cautiously the words you choose to communicate back to your client. That is, why it is important to use the same or similar words that your client has used. You have to remember what your client is feeling is very real and oftentimes very deep. Wrong word choice can oftentimes be harmful to process. Skill number 3, genuineness. Be honest, be yourself, be comfortable. Your actions need to reflect the words you're saying. I talked about this briefly when I walked through listening. Oftentimes we can say all the right things, but our hearts and our minds are far off. We need to be genuine in the things that we say. What we say should be paired with our behavior. For instance, if you have expressed that you are comfortable with helping them navigate through all issues, and you act surprised or uncomfortable when they talk about a more private or even intimate issue, this can be a stumbling block in growth process. Skill number 4, unconditional positive regard. Regardless of what is said, there needs to be an endless amount of kindness and an expression of caring. You may disagree or see flaws in their reasoning, but your job is not to argue them to your side, but to gently encourage them to see things through the scope of reality. We all need encouragement and guidance to help us see things through the scope of reality. Affirming the patient in their hurt, happiness, or confusion is a good way to convey to your patient that it is okay to be experiencing these emotions. Skill number 5, concreteness. It is important to stay focused on specific and relevant facts and feelings and to avoid getting off topic, making sweeping statements, or talking about the counselor rather than the client. Help the client to recognize and pursue growth in one specific area of the several presented. Reiterate the goal to the client and also the intent and structure of that specific session. Present questions and propositions to help the client clarify facts, terms, feelings, and goals, like a perception check. Adapt a here and now focus. This means that addressing the material that emerges in the room becomes the focus. Skill number 6, open questions. This is a helpful questioning method to get your client to clarify or explore thoughts and feelings. When asking open-ended questions, you don't want to request a specific bit of information or limit the question to a brief answer, yes or no. The goal is to guide deep explorative thought. If the client is already doing this, you wouldn't need to assist them with an open question. Ask intentional and purposeful questions. The goal is not to drill them. You don't want them to feel like they're being interrogated, but to help them work through the issue. You may want to follow up the patient's response with a paraphrase, which may encourage the client to share more. Skill number 7, counselor self-disclosure. This is when the counselor shares personal feelings, life experiences, or certain reactions to the client. As a common practice, it is safer not to self-disclose unless, for some reason, there is no other way to meet a clinical need, in which case it should only include relevant content intended to build them up. But recall, empathy does not mean sharing the same experiences, but being able to communicate what the client is feeling and thinking in a caring and understanding way. Skill number 8, Interpretation. This is any statement outside of what the patient has actually said or may even be aware of. When interpreting, the counselor is able to provide a new perspective, provoke thoughts or feelings, or present an explanation for behaviors. Interpretations may help patients connect things that they have compartmentalized, reveal patterns or themes, and it can offer a fresh way of thinking. You want to be sure not to overuse interpretation because this can come across as assuming or even accusatory. Skill number 9, information giving and removing obstacles to change. You want to humbly present data, facts, wisdom, resources, or answers to questions. Together with your patient, identify possible problems that may be hindering their growth process and think through possible solutions and alternatives. Thanks for watching this video over.
All right, so those are basic counseling skills that would serve a person in any setting, but we're going to unpack those a little bit and kind of apply them to a substance abuse setting where we work at. And the first skill we're going to talk about is attending. Attending is letting the client know you were with them and that you were listening. Carl Rogers said in some senses, attending and listening means that you lay aside yourself. This can only be done by a person who's secure enough in themselves that they know they will not get lost in what may turn out to be the strange and bizarre world of another, and then they can comfortably return to their own world when they wish. I do like that quote a lot. I like it because I've been doing this a long time now, and just when I think that I've heard everything and nothing can shock me, I get something new. And I think it's very important when attending, like, just to maintain a non-judgmental attitude and have a poker face, because if a client's sharing something personal or if client's going in depth on something that might make you uncomfortable, if you show that, that's going to shut them right down. So you want to be open because you want to work past that. And it's almost a privilege that person's letting you in to their inner world like that and share those details. So attending is expressing awareness and interest in what the client is communicating, both verbally and non-verbally. So attending is at large is just active listening skills. I mean, a little bit more because we're going to let the client talk more and we're going to guide where we can, but we're not so much putting our input, but we want to show that we're engaged in the conversation. So it includes active and reflective listening skills. In their own right, those are also other counselor skills that we'll talk about in a moment. So attending helps the clinician better understand the client through careful observation, and it helps the client feel relaxed and feel comfortable, express their ideas and feelings freely in their own way, build some trust with the counselor, establishes some rapport, and it allows them to take a more active role in their session because they feel comfortable doing so. So an acronym to think about some attendance skills when you're in session is the SOLAR model by Egan. So the S stands for sit squarely and face the client, maintain an open posture for O, lean in on occasion to show that you're engaged, make eye contact, and be relaxed and be natural in your behavior. And I think that last one's very important because, again, you don't want to put up a show or pretend you're faking. You want to be genuine in your approach. So, but it's just really maintaining attention on the client and staying engaged. I do have a short video that kind of unpacks the Egan Solar model a little bit further. We will watch.
This is Dave. He's trying to learn a language the traditional way, but they only teach him boring.
So that is some attendance skills in a nutshell, and just a way to have easy reference in your mind to think about it. Attending involves active and listening and nonverbal cues. It validates or invalidates verbal communication. It involves bodily behavior, the way what you're projecting, what you're giving off with your body language, facial expressions, voice-related behavior. So correctly responding with, "Oh, that's interesting," or "Hey, please move forward," or if it gets a little more severe, showing that in your voice as well. Reflective and active listening. It's part of attending, but they are also their own skills, as I already mentioned. It is listening where your clients are at in their lives. It is used to detect gaps, distortion, dissonance, and themes. It is listening to allow empathy, and is listening with appropriate interruptions. So that means, like, sometimes you got to keep your thoughts to yourself and hold that until the client's done speaking. If you have a question, don't interrupt if they're like going down a path. So hold on to your questions and then answer or ask them appropriate. And it's also listening without diagnosis. Like, we don't have to fix every problem. We're not going to immediate anyway. So sometimes, even if it is something that might hit DSM or something that we can see a little more clear, the client might not be there yet. So we want to be patient with that and avoid just automatically trying to identify and fix the problem. So with reflective listening, there is some levels of it. There's a simple reflecting, which is pretty much just mirroring back what the client was said. And that can be used through paraphrasing or summarizing. And paraphrasing is more like words and using words that are similar to what the client just said, but a little bit fewer. And summarizing is using your own words, but linking the concepts or ideas the client was sharing together and putting it back in your language just to make sure that you're following correctly. Then there's a complex reflection, which is a little bit more because it involves the same paraphrasing and summarizing when you're giving it back, but the reflection skill here also, you're taking into account what you're seeing the client exhibiting behavior. So if the client's like fidgety, you can tell he's a little bit anxious, and then you can summarize and then add on it, but it seems as making a little anxious, or perhaps you're dealing with something that you spoke to a mandator like probation or treatment court liaison, and they reported something. And so there's might be some inconsistencies there with the client saying what you were told. So you want to be mindful of that. So a complex reflection involves that. It involves like taking what the client said and taking everything else you got, like nonverbal behavior, and also maybe something from collateral contact, and then summarizing it together to kind of reflect what was going on. So reflecting helps the clinician check whether or not they accurately understood what the client is saying and feeling, and it brings out problem areas with the client without the client being pushed or forced. Reflecting helps the client realize that the counselor understands what was said or felt, and it increases awareness of their thoughts or feelings, and it helps them learn that thoughts, feelings, and behaviors are connected. Reflection of feelings. Reflections of feelings is when the clinician expresses the client's feelings, either stated or implied. It is a complex reflection skill. The counselor tries to perceive the emotional state of the client and respond in a way that demonstrates an understanding of the client's emotional state. So that goes back to the example I gave just a minute ago, where like if the client's telling you something and you can physically see they are agitated, then you include that in your reflection. I also have a short video on that, unpack it a little bit more and kind of show what it looks like.
Does your skin suck because of acne, dark spots, oily or dry skin like me? Well, good. Okay, well, actually that's not good.
Reflective listening is the ability to bounce back at them what they're saying. This is a skill that doesn't come naturally to us. When involved in a conversation, we tend to talk about ourselves or give advice. We try to make them feel better or agree or disagree or tell stories. In order to be a good reflective listener, we need to set aside our own wants briefly and work to make sure that your person gets your attention, your empathy, and that you show them that you understand what they're saying. Reflective listening helps people know if you're understanding them, and at its best, it can help them clarify their thinking. It helps them understand what's underneath those thoughts and emotions, and help them find solutions on their own. So it's basically a magical thing. I spent a year learning this skill in grad school, and I've spent the next 7 years reminding myself to use it. It is my most powerful therapeutic tool, but it's so simple that most people can learn the basics and begin to practice it on their own. The simplest level of reflective listening is to simply show them that you understand them by summarizing what they say and asking them if you got it right. If you try to do this without a relationship, then this can sound really patronizing and condescending. So make sure to be sincere. Basically, you take what they said and you put it into your own words with a question mark at the end. So let's use an example of a teen who really wants to go to a concert with his friends. He might say, "Mom, all my friends are going to this concert. Ariana Grande is the best singer ever. And the opening band is awesome, and I've saved up all the money, and I just have to go. You are so unfair." So staying on the content level, you might say something like, "You really want to go to the concert tonight." This may seem so basic, so obvious, that we often just skip over it. But remember, good listening isn't just about understanding, it's about showing them that you understand. And making little reflective statements like this can go a long way to help the other person feel understood. It doesn't do you or them any good if you understand them, but they don't know it. Hearing it back can be a good part of the healing process for some people. You can also use this if you're unsure exactly what they mean. For example, you could say, "Let me see if I'm getting this straight. You're angry with your sister because she borrowed your astronomy books without asking?" It's also important to ask if you got it right. For example, I was recently in a session with a couple, and the woman was explaining how it made her feel shut down and upset when her husband always tried to solve her emotions instead of listening to her. While talking with the husband about empathic listening, he seemed frustrated about her not accepting his quick advice. I threw out a guess. "So when she doesn't accept your advice, you feel rejected?" He took a moment, paused, and then clarified. "No, it's not that," he said. "I can handle my solutions being rejected, or even me personally being rejected. It's that I just love fixing things. It's part of who I am." So I tried again. "So you feel a little lost? Like unsure of what to do if you can't be a fixer?" He replied, "Exactly. Like, what is my role? I want to be doing some good. And if I can't fix anything, I feel like there's no point." After I understood him and he knew I understood him, I was able to address his real concern by explaining that just listening to and validating emotions can actually be more helpful, and it genuinely does some good. And because he knew that I understood him, he accepted me and my advice. This is basically staying on the content level. The next level is to use reflecting to help them clarify their thoughts and make it more concrete. So when people understand why they're feeling or thinking that way, then there's greater potential to find solutions or acceptance. When this is done from a "I will fix you" attitude, this will feel like judgment. So don't try to diagnose them or be their therapist. Be sincere, be humble, be curious, and ask questions to clarify, but not to guide the conversation. So this is the emotion level, helping them understand their emotions. So back to the concert example, you could say something like, "You're upset that I don't trust you," or "You probably feel annoyed that I don't get you," or "You're feeling sad and angry that you can't do something really important to you." Now, at this point, you may be wondering, why am I making these statements instead of just asking the question, "Are you feeling angry?" Well, here's why. With good listening, statements are often better than questions because, number one, questions are about your agenda and not theirs. Questions make it so that you are now directing the conversation in the direction you want it to go, instead of being the listener who is trying to understand. You become the person deciding where the conversation should go. You may hear what you want to hear, but they may not be able to say what they're trying to say. This discourages the other from speaking their mind. Number two, questions often make the other person feel interrogated or on the defensive, and this leads them to being less open. Now, I'm not saying you should never ask questions, but in general, people ask too many questions under the guise of listening. Try to catch yourself, let go of your agenda, and use more reflective statements. Pay close attention, and you'll see that it will invite more openness. At its very best, reflective listening helps the speaker express and understand concepts that are at the leading edge of their comprehension, meaning that they don't really understand them yet, but by talking about them and expressing them, they'll learn things about themselves and their emotions that they didn't know before the conversation. So this is the meaning level, helping them express what all this means to them. So when we bounce back something at the meaning level, we might be saying something like, "You're afraid that I'm saying that you're a bad person, or you're not good enough to go to that concert. You really want to be trustworthy, but it hurts to think that I don't believe in your abilities. You're frustrated that you don't have complete freedom in your life yet. And I bet it's really annoying to you to have rules that you don't agree with. Maybe this makes you feel like you don't have power over your own life." Or here's another example. "I'm pretty sure Marco loves me, but he doesn't put effort into big celebrations like my birthday or our anniversary. So you're feeling unappreciated and you wish for Marco to be more thoughtful and chivalrous?" Exactly. For example, for my birthday last month, ... And Amelia continues expressing herself. We don't need to go to the deepest level every time. When we use reflective listening, we can address content, feelings, meanings, and sum things up. Here's some examples of how that would sound. So from your point of view, it sounds like you're feeling, you believe, it seems like, what I guess you're feeling is, it might be that you... Some measure of guessing, like making these tentative statements, can be helpful. You're not trying to be a therapist, but rather to help yourself and them better understand. Also, don't diagnose, solve, judge, or argue. Don't tell the other person their motives or analyze them. Your goal is not to figure them out, but to get on the same page with them. Show them that you understand by summarizing, asking to clarify, and looking for deeper meaning. This video is an excerpt from my intensive course on how to help when someone you care.
All right, there's some reflective listening skills. All right, these next couple, I'm going to go through and then I'm going to talk about them together because I think they kind of go together. Genuineness. Be honest, be yourself, be comfortable. Your actions need to reflect the words you were saying. We need to be genuine in the things that we say. What we say should be paired with our behavior. Genuineness helps the clinician establish and maintain the therapeutic alliance, and this is going to be so important. And the therapeutic alliance and rapport is everything. And it develops the connection needed to assist in more troubling areas. Being genuine helps the client feel relaxed and comfortable to share and work on more intimate and personal issues, feel heard and understood, and again, just builds trust in the counselor. Being non-judgmental and demonstrating unconditional positive regard. That's another one that we're going to talk about. It's regardless of what is said, there needs to be an endless amount of kindness and expression of caring. You may disagree or see flaws in the reason, but your job is not to argue them to your side, but to gently encourage them to see things through the scope of reality. Being non-judgmental and demonstrating unconditional positive regard helps the clinician convey the client is okay in experiencing these emotions, provide encouragement and guidance to help us see things through the scope of reality. Unconditional positive regard helps the client keep things in perspective and reality based. I mean, when we're not feeling judged or defensive, and that's why I want to pair the next two together, because when they feel that we're genuinely on their team and care, the client's just more apt to listen to us when we might be working on a tough issue. It increases collaboration, participation in treatment planning, and trust the counselor they are working with them and have their best interests at heart. Concreteness. Concreteness, I think, also goes with consistency, and it is important to stay focused on specific and relevant facts and feelings and avoid getting off topic, making sweeping statements or talking about the counselor rather than the client. And I think that even applies to the counselor's feelings. Like maybe the client, we have to stay consistent in our delivery. So like our field is kind of unique because we have to work collaboratively with so many mandators and whatnot. And we can't go based on how we might not be feeling something's unfair or unjust that the client might be going through. We have to also keep it reality based in our perspective, because regardless of the feelings, we might not have all the facts. And at the end of the day, our job is to like get our client to a good place, get them stable, help them work through any consequences they might be facing. And if we're working out of our feelings, that gets a little cloudy sometimes. And so something we might encourage the client to do might not be beneficial or adhere to something there might be mandated to in like treatment court or family court per se. It is also important to stay focused on grounded on concrete goals that assist the client in functional areas such as social, vocational, legal, or family that they may be working on. So again, what I just said was a good example. If treatment court, I mean, I want to be clear. I hear so many times that like legal systems do not tell us what to do. We make the recommendations, and that is true. That is true at the end of the day. But it also is treatment court. If a client is demonstrating the inability to maintain sobriety, and treatment court's kind of being very clear that they feel he needs inpatient, that might be something we want to work with the client on getting in and kind of refocus our goals. Whether we can't get defensive because treatment court's strongly suggestion, what we have to keep in mind is if we go against that and kind of work opposite of treatment court, if the client has another slip or continues the behavior, they're probably going to go to jail. And we don't want that for our clients. We want to get free and start reestablishing, build a positive life. Concreteness helps the clinician present questions and propositions to help the client clarify facts, terms, feelings, and goals, and it reiterates the goals of the client, also the intent and structure of that specific session. Being concrete helps the client recognize and pursue growth in one specific area or several that are presented. And it helps them stay rooted. Although self-direction is a crucial element in person-centered care, and we all know this, it is a collaborative effort and between us and the client. So I'm going to tie that all in together right now with being the genuine and approaching being non-judgmental and unconditional positive regard. All those really go into establishing that rapport and that alliance that we have with the client so that they trust us and that they understand, like back to the treatment court example, if we say, hey man, I hear you and I believe in you that you might be able to do this, but it seems like treatment court's kind of at the end of the rope with you, and it might be beneficial to adhere to what they're requesting and also just in maintaining sobriety. Maybe going inpatient would help get a little bit of stability and get a little bit of clean time, get through that. Empathy. Another Carl Rogers quote, it means entering the private perceptual world of the other and becoming thoroughly at home in it. It involves being sensitive moment by moment to the changing felt meanings which flow in this other person, to the fear or rage or tenderness or confusion or whatever he or she is experiencing. It means temporarily living in another's lives, moving about it and delicately without making judgment. It is not what I would feel as me in your shoes, but what I would feel as you in your shoes. Empathetic responses. Give yourself time to think before responding. Use short responses. Don't over elaborate. Don't mimic, remain yourself, but allow yourself to feel what they may be feeling. Empathy's don'ts. Don't give no response at all. I mean, silence is also a clinical skill. We'll talk a little bit down the line, but if it's time to portray empathy or needed, and that's not the appropriate one. Don't ask a question. Don't use a cliche like that which doesn't kill us only makes us stronger. I mean, if we're really working through something, even in our own lives, I mean, we don't want to hear like a catchy saying, like we're really looking to be felt and heard and understood. And that goes to our clients as well. So avoid that. An interruption or interpretation. I'm trying to diagnose, like we talked about earlier, like we're not going to fix everything in that session or right there. And if it's time to just be listening and show some empathy, that's time that we don't want to do that. Don't offer advice, don't parrot what they're saying, and don't use sympathy. And sympathy and empathy are very different. Sympathy is kind of like a pity party or feeling sorry for the client. And I know I personally don't like that if I'm going through something that's portrayed. And I also believe that applies to people we're working with. I've got a quick video right here to kind of demonstrate what empathy is about. I have a couple here on these ones.
Hey, yo, let's get magical. New Lego Friends magical Ferris wheel and slide out now.
No, you can't take my rocket to the dump. Riley and I go to the moon. Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time. We had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
All right, there was a demonstration of empathy in a children's movie. I like that movie very much. If you're not familiar, it's kind of inside a young woman's brain and shows like neurodevelopment and whatnot. And the blue female was sadness and the other one was joy. And the elephant type creature was imaginary friend. And joy is always happy and go lucky. So you see, she just tried to cheer him up, but that wasn't the correct approach at that time. Sadness could kind of relate to that feeling and understood what he might be going through. So she was kind of the one that stepped up and was able to demonstrate some empathy because she got it. Expressing empathy. Brene Brown discusses 4 key steps to it, showing empathy. It's perspective taken is step number 1, or putting yourself in someone else's shoes, staying out of judgment and listening, recognize emotion in another person that you have may felt before. We've all felt them all. We've all felt sadness. We've all felt frustration, fear, loneliness, love, joy. It's articulating the emotion back to the person who is having it. I also have a Brene Brown explanation of it right here. Just another quick video.
It's just, the nature of us as nurses to care for people.
I could not have made it with.
So what is empathy and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Sorry about that at the end there. I thought it was the end, but then it seemed to keep going, so I hit play again. So empathy. There it is in a nutshell, in the best way I can think of describe it. It's just recognizing what that feeling's like, but recognizing that that other person is experiencing their own way, and you can relate on some level, but you can never completely. All our experiences are unique to ourselves. So even if we go through the same things, we might not necessarily experience it the same way. So it's not necessarily looking for the experience, but the feeling involved to demonstrate empathy. Probing and encouraging questions. Don't ask too many questions during session. Again, we're trying to let the client talk, and because I believe that innately we all know the correct path many times. Not always. Sometimes we're a little bit lost, but a lot of times we kind of know what the right things to do. Maybe we're just struggling with getting ourselves to do it, or maybe we're in some defense mechanisms and justifying or rationalizing ways to not do this thing that we know we have to do, but not necessarily ready to. So we kind of want to try to help the client get there on its own. And that's really where the self-direction part, especially if it's headed in a positive direction, that's going to allow growth. We want to ask questions that serve a purpose. We want to ask open-ended questions that helps the clients talk about specific experience, behaviors, and feelings. We want to keep the focus on the clients, and we want to ask questions that help the clients move forward in the process. Don't hesitate to check in with the patient about how they're handling the process. So let's talk about open-ended and closed-end questions a bit. Open-end questions. Questions that clients can easily answer yes or no with. Cannot, I'm sorry. I said can, and I was like, wait, this is open-end question. Sorry about that. Questions that clients cannot easily answer with yes or no or 1 or 2 word responses. Purpose of open-end questions are to begin an interview, to encourage client elaboration. So like to explore something further. You don't want to answer, if we're really looking to get the root of something, we don't want to just stop the conversation by allowing a yes or no. So we want to look for that opportunity to ask something that's going to allow the client to elaborate. We want that purpose of them is also to elicit specific example and to motivate clients to communicate. Example of open-end questions will be, tell me about your family while you were growing up. Why is that important to you? How did you feel when that happened? What did you do when she said that? What are the reasons for saying that? So again, these are questions that are not just easily answered with yes or no. In each example, the client's going to have to kind of give a little backstory, an explanation of why they felt that way or what had happened. Opposite is that's closed-ended questions, questions that the other can easily answer with yes or no, or a 1 or 2 word response. Purpose of closed-ended questions, to obtain specific information, like how many kids do you have, to identify parameters of problem or issues, to narrow the topic of discussion, to interrupt an over talkative client. So it's a skill, and I think it should be avoided, but if you've been in session, I think sometimes we can all relate to that, getting off topic or kind of all over the place. At times we want to refocus and reground. So doing that, it's kind of a grounding activity. Examples of close-ended questions. Are you going to have that test done? Yes or no? Did you drink before you got into the car? Yes or no? Do you drink often? Do you exercise? Do you like your job? Closed versus open-ended questions. Closed question, are you scared? And open in the same topic, how do you feel? Closed-end question, are you connected about what you will do if the test results are positive? Open-ended would be, what do you think you might do if the test results are positive? Closed-ended question is your relationship with your husband a good one? An open one would be, tell me about the relationship with your husband. Self-disclosure. When do I use self-disclosure? How much is too much? Why does the client want to know? How might it benefit the client? How do you feel about giving the information? Why do you feel you should or should not give the information? So I think a common way that I was taught a long time ago and to think about this is, what does it have to do with session? Is what you're going to disclose about you, or is it something that's going to really relate to what the client needs to hear at that time? And again, you should never go into detail. I give the example a lot with self-disclosure. For instance, like I might tell a client that I'm married with kids, but I'm not going to tell them that my wife and I had an argument last night, because then that's me using that session inappropriately, and for me, not the benefit of the client. Silence is a counseling skill. That's another one we talked about that earlier. Sometimes you got to leave it open. You got to leave it. You don't want to interrupt if something's going down a road, and it can also just allow that space for the client to process for a minute and further expand on something. It can encourage the client to reflect and continue sharing. It can also allow the client to experience the power of his or her own words. Confrontation. This is another counseling skill. Maybe better said would be carefrontation, because I think a confrontation, we're not in an argument or nothing like that, but sometimes we need to address things that a client might not always want to hear. I mean, we work in a field that a lot of times we are working to change behavior that a client might not always want to change, especially when they're early on in the process and they're just getting going and they're not ready to do these things, or even talk about like minimizing use deep in the pre-contemplative stage, if you know that, or contemplative. And sometimes, like, if you want to change something, you at least have to acknowledge it. And if we're trying all our skills and it's just not getting through, sometimes the only way to do it is to say it directly. So there's two types of confrontation. Type one is to focus the client to look at their lives in an accurate and honest manner. And it works under assumption the counselor holds the knowledge of what is accurate and honest. So again, if we're working in person-centered and self-direction, like, this is not a go-to, definitely, but also there's just going to be times that a client might need to hear that type one. Like, if, back to the treatment court example we discussed earlier, if you don't go to inpatient, you're probably going to get kicked out of treatment court and have to go to jail. Maybe they're trying to rationalize and get out of that. Maybe, like, it's not so much that maybe there's two scenarios I can think of. In one case, maybe the client is making some progress and you and him both know that, or her, and that might be something different. Like, this feels like a punishment, and there might be another way to come at it. But maybe you are seeing exactly what treatment court's seeing, and this client is just studying the use, and they need to hear that, like, you are at the end of the rope. So again, it's not the pull out right from the door one, but at times it is needed. Type two is the focus on identifying, pointing out inconsistencies and discrepancies that client might recognize in themselves. And confrontations are interventions that point out discrepancy in clients' beliefs, behaviors, words, or non-behavioral behaviors. And type two would obviously be the more ideal, because that is more relevant, and we might have to do in a more regular practice in our sessions. I mean, again, back to that, we're dealing with behavior changes. People don't always want to change. If we have time, and because it is a progress and it's a path and it takes time. So if we have time to work with a client like that, but still need to point out some discrepancies or what's being said and what's really happening in the client's life, then it's the type two. Like, type one should be avoided, but I do think on rare occasion, a type one might be needed. Types of discrepancies you might be looking for: the person says one thing and does another. The person has one perception of events and you have another. The person tells you one thing about their body language, sends a different message. The person says they have certain values, but their behavior violates those values. And I think all those are pretty self-explanatory and reasons we might want to do some discrepancy building and kind of confront the difference between what being said and what's being displayed or actually happened. I mean, it is so important that we keep things reality-based. On some level, I do believe that we just have this responsibility. Like, even though the client's life is their life and it's not our own, we also have to be mindful that we do have an influence in their life, and we want to help them the best we can, and we want to get them through whatever hurdles they're facing or obstacles they're going through. And if a client might not, I mean, again, back to the path thing, sometimes we have time, and that path can be, and maybe their use isn't at a point where we have to worry about overdose or harm or anything like that. So we can give it more time and use these kind of like skills to get a client where they need to be. On other times when there's a increased risk of overdose or they have prison or jail looming over their heads, like, we might want to get a little more focus on discrepancy building. So the discrepancies building should always be present, but I think that goes back to the confrontation part, type one, type two, on where the client's at in their life. Because if we do not keep it reality focused and we allow down that path, or them like rationalizations, justifications that they might be using to continue what they're doing, and we can see clearly that that might not be the right way. We can't make a client do anything. You know, I think about motivational interviewing a lot. I know I learned about it years ago, but there's this part of it is, if you see a client headed off a cliff, resist the rightening reflex. And I think that is so true. I think that in life in general, whether it be substance abuse or anything, that there is a value in learning from our mistakes. And I know early in recovery, one of my things is I kind of follow the client, and if we're going to run into walls, we're going to run into them together. And I'm just going to, it's like, okay, that just happened. You know, you want to try something different. You want to try another route. You know what I mean? So again, I think the motivational interviewing perspective on that to resist that rightening reflex is crucial. And if they're headed off a cliff, that might be what's needed. But at the same point, I guess the discrepancy building and trying to get in front of that just a little bit anyways is not necessarily stopping or impeding on that person's life path, but holding up a stop sign or slow down sign. You know what I mean? Like, I think that's how it would be, and hopefully they'll come to that realization alone. But if they go off that cliff, sometimes I think that we need to fall so we can learn how to get back up. And I think there's something to that just in life in general. All right, so I do have a couple more videos, and then we're almost done with this for today. I just want to make sure I'm not wrong. So yes, I got one on confrontation and I got one on self-disclosure.
Beverly, there's often a need for us to confront clients in the work that we do. What are some ways that we can approach confrontation respectfully?
That's a very good question. I noticed that some staff who are very nice people avoid confrontation because they feel as though it's going to be an attack on somebody, and they're not comfortable with attacking folks. Now, I think that kind of confrontation is negative confrontation. It's not going to be effective. So I think about what I want confrontation to do. Here's what usually happens. I see somebody doing something that's non-productive. For example, I see them not attending their activity. I see them not solving a problem. I see them not making a plan. I see them not following through. Or I see something that's really hard. I see or notice body odor or an appearance that's going to be a problem. I see that as a problem. I think it's going to stand in the way of their being able to do what we want them to do, and I need to bring it to their attention. Now I got to think about something. Confrontation is best done when there is a relationship. If you've got a good relationship, for example, with a long-term friend, they can say lots of things to you that perfect strangers can't say. So, as I think about doing the confrontation, I've got to think about, is this relationship such that this person can hear this from me and do something about it? Because I don't want to just attack them. I want to bring it to their attention so that they will change the behavior that I think is standing in the way. So that means I got to think about the relationship that I've got with the person, and will it allow me to confront them about this particular issue? Well, but sometimes I've got to confront somebody when the relationship isn't that strong. Okay, sometimes we're in the position of that. I see something that's standing in the way of this person being able to move forward. The relationship isn't strong, so I've got to confront it. Now I've got to think about the words that I use. Certain words will send people off. Examples. What you need to do is. The problem with you is. What's wrong with you is. Everything after you say after those words they did not hear. They go click. So if I know those words will cause people not to hear what I say, then I change the words. I say, for example, is it possible that, perhaps, maybe, can we look at it this way? Because those words tend to keep people's ears open so they don't dismiss everything that I had planned to say after that. So confrontation, again, is another tool in that box. Confrontation requires that I've done some good listening before. Confrontation requires that I've asked some good questions. It's not a skill I can use right off the bat. It's a much tougher skill to do, so I have to think very carefully about when I use it, how I use it, so that it does not become an attack on people, so that it's done in a respectful way, but it brings something to their attention that I think is a problem, and then thinking about how do I introduce that to them in a way that would want to make them do something about it. Change it, because that's what I'm really after, is getting them to change their behavior, not just tell them what's wrong.
Confrontation as a counseling skill. Again, I want to be clear. This isn't the thing that you have a hammer, so everything becomes a nail. It's not always the correct intervention, but there are just as times that confrontation is needed. And again, back to what I said earlier, I mean, if we're really going to work on things and we're really going to change a behavior, the first thing we need to do is at least acknowledge it's there. We need to acknowledge it's a problem. And sometimes we can get there naturally, and some other times it's kind of a thing that needs to be said, like this needs to stop. You know, there's a way to do it. I like that video a lot because it's kind of, I agree with a lot of what she said. That's kind of how I view it as well. It's how you say things. You don't want to be a jerk, and you don't want to be standing over there, you better do this or what, but you do want to call attention to it. And again, pulling some of that discrepancy build and point to benefits of that. It might be time to change something, or on the flip side of that, the continued consequences or what may get worse if that behavior continues. So it is definitely just pretty much about behavioral change, and it's not about being judgmental or putting your own stuff on it. Just I stay reality based a lot, you know, and it's just keeping things in perspective sometimes. Self-disclosure, I got a video for that in a second, and we're going to talk about it a little bit more. The counselor shares personal information, ideas, values, attitudes, and experience. It must relate directly to the client's situation. So again, we can't be self-disclosed to boast ourselves up or work through something we might be dealing with in our own lives or anything like that. Self-disclosure, I do try to avoid at all costs, and I do recommend that. I know a lot of times clients might ask me directly something. That's my reflex response at this point is, what does that have to do with your treatment? What does that have to do? How's that going to help you today? Knowing that. But there's other times that it goes into some empathy that it might be a valuable tool, and it's an example that worked for you maybe in something. And again, you don't want to get too personal because you just don't. It's hard being a counselor. I do not deny we do not have a hard job, but it's so rewarding in so many ways. And I hope that you all find it that way too. But there's just this balance we have to maintain where we are trying to establish that rapport and kind of build some type of personal connection, but at the same time maintaining our professional boundaries and keeping that clear that we're on your team, we're here for you, but this is a working relationship that's going to end kind of, it's almost an artificial relationship if you think about it. I mean, yes, do we have I have clients that still, maybe they're in continuing care and they check in and whatnot, and that's nice, but like, we're not going to be getting with these people and going out for coffee, or we're not going to go to their house for dinner or invite them over for holidays. So it is artificial and a little bit like that, and it does come to an end. Benefits and risks of self-disclosure can build a sense of trust and rapport. Appropriate self-disclosure can enable the counseling relationship to move to deeper levels, or it may threaten the client. It may move focus from counselor to client, and the counselor's motivations become unclear to the client. Like, I think if we're oversharing and we're going too much in our life, the counselors might be, their client's going to kind of be like, why are we in there always talking about this person? And it's supposed to be about me. Problematic self-disclosure. Excessive self-disclosure shifts the focus from the client to the counselor. Minimum self-disclosure gives appearance of aloofness. Inappropriate self-disclosure can be seen as phony and manipulative. And we definitely, that goes back to being genuine as a skill. I mean, people see through fakeness. So we want to be as real as we can and on a personal and professional level. So I do have a video on self-disclosure, and we're going to wrap this up.
You won't believe it. You don't have to work hard to learn a new language. Really? Yeah. The only thing you need to do is to work.
Let me start today by telling you some information about myself. My name is Patricia Harris Jenkinson. I am a professor of communication. I am married. I have 2 children, and I live in the Sacramento area. Now you know a little bit about me. Let me tell you a little bit about self-disclosure. This is in multiple parts. The part that we're talking about, part 1, we're going to focus on what self-disclosure is. Starting with the definition, self-disclosure can be defined as the process of deliberately revealing significant information about oneself that would not normally be known to others. So 3 key points. It must be deliberate, it must be significant, and not otherwise known. So by deliberate, we mean it's intentional, that you are not accidentally revealing information about yourself. You intentionally told somebody information. By significant, it means it's not trivial information. It's important information. And it's got to be information that is not otherwise known to others. For example, you can tell by not only my name, Patricia, but my voice that I am most likely female. So if I said, "Hi, I'm Patty Harris Jenkinson, I'm female," that might be deliberate. It might be significant, but if you're one of my students, you probably already know that information. So that would not be defined as significant self-disclosure. James Baldwin once said that in order to have a conversation with someone, you have to reveal yourself. So self-disclosure is part of sharing information so that you can communicate with other people. It's not always what you say, but it also might be how you say it, or what you don't say, but what you reveal through your nonverbal information. If you allow somebody to see you cry, then that would be an example, or could be an example, of self-disclosure. What kinds of things do we self-disclose? What we self-disclose means that we are risking information. So self-disclosure involves risk. At least 3 risks that we can talk about. The first is that the other person can share revealed information, the information that you told them, with other people, and you might not want that information out there. The second is just by having that information, the other person has power over you. They can blackmail you. And lastly is if you tell somebody you like information about yourself, that person could choose to reject or disapprove of you. So the bottom line is that self-disclosure means vulnerability. When you self-disclose information about yourself to others, then you are opening yourself up. You are becoming much more vulnerable. When we talk about the things that you could self-disclose, obviously not all pieces of information are rated equal. We often communicate with people using cliches. "Hi, how are you?" "Oh, I'm fine." Or even, "Hi, how are you?" "Oh, could be better, could be worse." Really not much deep self-disclosure, very much ritualistic communication. "I'm really had a good time." Sure, that's revealing information about yourself, but it is much more of a cliche and not deep. You can provide facts or biographical information, and by that, we're talking about what's non-threatening. So biological information that I gave you in the beginning, I am a mother of 2 children, I am married, and I live in the Sacramento area. How different would that be if I told you exactly where I lived, how old my children were, what the names of my children are, and depending upon the situation, that could be much more threatening information. And I would not be likely to reveal that information to anybody who happens to run across this video on YouTube. Next in that level, a little deeper, is the opinions, how you feel, your attitudes and your personal ideas, whether you like a movie or not, whether you like a particular person or not, what you think the political climate is. All of those would be attitudes and personal ideas. We can follow up with that with a deeper level of personal feelings, my fears, the secrets that I hold. And although you see attitudes on there twice, they're much more deeper attitudes. So I might say, in terms of an opinion, I don't like it when you go out without me. It's just not right that you go out and visit your friends without me there. The personal feelings part might be, I'm afraid that you like them more than you like me, or I'm afraid I might be losing you. So much deeper level. And finally, there are things that you hold on a very gut level that you don't tell very many people at all. Very, very rare. You're not likely to tell people if you have had an affair unless you're very, very close to them, but much more increased level of self-disclosure. Before we move on to the next one, I want you to think about what we've just talked about. So 3 quick questions for you to reflect upon. Can you identify the 3 criteria for a disclosure to be classified as self-disclosure? Secondly, how would you classify I have a boyfriend? Would that be self-disclosure? And finally, can a fact or biographical information also be considered peak self-disclosure? Just some thoughts. We'll continue to.
All right. Self-disclosure in a nutshell defined. I would say that in relation to that video, facts are always safe as long as they're not too in depth. Like again, the example where I would say I might self-disclose I am married, but I'm not going to self-disclose that I had a fight or argument with my wife last night. Opinions, I think if they're asked for or offered and the client agrees, the feelings and the peak ones, I think we just need to avoid that at all costs. Again, I'm not talking about in an empathetic way where we relate to the client and demonstrate that, talking about how, if we're talking about how this makes me feel, because that is not what the sessions are for. So these are counseling skills all wrapped up in a basic to get you started or to improve upon. I mean, there is so much more going to it. This is for individual sessions or any interactions we might have with a client, how we should be working towards our professionalism and demonstrating that and always in everything we do. There's other skills that go into counselor, obviously, group counseling skills, where some of this will come into place, but also has its own strategies. And then there's like treatment modalities and assessment, which are also counselor skills, but this is for the actual interaction one-on-one, these counseling skills. So after this training, there is a test to complete. It will be available to you once you submit that. You are all set. Have a nice day.